We've collected questions through social media and constituent mail, and we'll be using these questions to drive the discussion. If you're watching live on Facebook and have a question, please post your question in the comment section of this video, and we will be answering questions from live viewers as well. Before we get to questions, I'll hand this off to Congressman Heck and then Director Ezelle for opening remarks. Congressman Heck.
Thank you, Rena, very much, and welcome, Director Ezelle, and we extend to you our appreciation as well for giving of your time here. Indeed, I thank all of you who are taking the time to watch and learn more about what the state's Emergency Management Services is doing to help cope with the COVID-19 crisis. Before I explain a little bit more about what Director Ezelle's job actually is, I think it is noteworthy that he is also a retired colonel in the United States Air Force and a jet fighter pilot. In fact, as he told me before the program began, a flyer of F-4s, F-15s, and F-16s. And those of you who know anything about that, you know that's a pretty thrilling way to have a career. Director Ezelle, thanks very much for being here. So, Rena gave your title. Here's what the jargon-laden description of that is. You are responsible for leading and coordinating mitigation, preparedness, response, and recovery activities to minimize the impact of disasters and emergencies on the people, property, and environment and economy of Washington State. What does that really mean, sir?
Thank you, Congressman. I think at its most basic, it's helping the people of Washington when something really bad happens. To take it up from there, it's we are in support of local jurisdictions, your counties and your cities. So when something happens in their jurisdictions and they need help, we're there to provide that help from the state level. We also coordinate the efforts of state government. So when there's multiple agencies who have capabilities to bear, like there are right now in our COVID-19 fight, we coordinate the effort of the state agencies. And then finally, we are the bridge between the federal government when federal assistance, disaster assistance comes into the state. We're the agency through which that is administered to get it out to either the people or the municipalities of Washington to help. And then finally, we also work with our non-governmental stakeholders, such as the Red Cross, Volunteers in Service to America, and other philanthropic groups who help in case of disasters and emergencies.
So use the example of a municipality that had some kind of a disaster or an emergency. You said you are there to help. What kinds of help?
Well, we look and see what that municipality would need. In the case of, let's say, wildfire, it would be help with sheltering. We've coordinated the provision of meals, foreign language translation of messaging, help with evacuation planning. That would be things that we would do in the case of fire. In the case of a flood, it would be things like coordinating sandbagging. Ultimately, it could even be bringing in the National Guard resources, as we've seen happen over the last several years.
How many people do you have to undertake this mission?
Well, we're growing a little bit just due to the complexity of what we've been dealing with. But before COVID started, we had about 85 permanent party full-time people and another 25 or so who are project employees that since the flooding, we've needed to plus up both our public assistance team and our mitigation team to deal with the realities of two major disasters going on simultaneously.
Prior to plussing up of the 85 people that you had full-time, what is the single largest number of jobs within that group?
I would say that if you look at it, it's primarily grants management. And we're broken up into so many different lines of effort. But if you look at the Homeland Security and Emergency Preparedness grants, coupled with the mitigation grants that help counties get ready, and the 911 grants that go out to counties, a large portion of what we do is money passing through either state or federal funds to our local partners to help with their programs.
You help them get the money.
We help them get the money, we administer it, and follow up to make sure that the money is being spent correctly.
And you're located at Camp Murray?
We're at Camp Murray, about midway between Olympia and Tacoma, opposite Fort Lewis.
And how long have you been on the job, sir?
I've been the director for coming up 7.5 years, and I've been with the Emergency Management Division coming up on 10.
Great. That's excellent background and context. So maybe now we could get to some of the questions, Rena.
Thank you both. Let's start with a question from Joanna from Olympia. Hi, Robert. How has the current economic, political, and pandemic environment affected the State Emergency Operations Center? How? And what is the biggest challenge?
Well, it's affected us greatly because when the COVID pandemic kicked off, we were already in the middle of probably the state's worst flooding disaster in 10 to 15 years. So we had to shift and stand up in support of Department of Health, who was designated by the governor as the lead agency for dealing with this crisis. And so we were all hands on deck, bringing in our own staff and staff from a multiplicity of state agencies to help Department of Health. We found ourselves immediately involved in the personal protective equipment crisis, which I'm sure everybody is familiar with, trying to source desperately needed equipment by our first responders and our medical community. We stood up that coordinating role that I mentioned earlier, and we formed a unified coordination group, which is under FEMA doctrine is the way that we would set up the coordinating structure between state and federal partners, meeting daily at first and a little bit less frequently now, to make sure that we are fully coordinating, sharing information, and making sure that we are as synchronized as we can possibly be between the state and federal government and providing resources out there to the people who desperately need it. In terms of the challenge and all of the disasters and incidents that I've handled over the course of my career, it always boils down to communication and coordination. It's making sure that people are working together, that they are synchronizing, that they're communicating what they're doing, that they are looking at who else is impacted. And so that's what that coordinating structure that I just referred to is designed to do. And so we are working very, very hard to make sure that we are presenting as unified a response to the people of Washington as we possibly can. As I mentioned earlier, we were all hands on deck. We've been able to, as structures and systems and processes have come into place, as Department of Health is feeling their rhythm, as DSHS, another one of our major partners, is feeling their rhythm, we're able to, perhaps take down the level of activity that's in the state EOC. But another thing that I am very, very trying to be as tuned in on as I possibly can be is, what does the future hold? What is the disease going to bring back on us? So I've got a team of people who are out there scouring the literature, looking at what the future trends might be, what a continuation of first wave looks like, or a second wave, and what do we need to do to posture ourselves and encourage our partner agencies to posture as, to make sure that we're able to deal with the challenges it evolves over the weeks and months to come. So hopefully that answered the question.
So I understood you when you were talking about coordination and communication, that's kind of making sure you sit at the top of the pyramid, maybe not authoritatively, but in terms of the perch, so that always the left hand knows what the right hand's doing. There is a deconfliction, as we would call it in a war theater. And in fact, we are optimizing the allocation of resources and people towards solving problems without being redundant, without working at cross purposes. Is that another way to describe how you operationalize that role?
I would say that's exactly, that's perfect description of what we are trying to do.
Very good. So in terms of the effort related to COVID-19, you described several of them, but what one probably you would estimate consumes the greatest amount of your time and effort?
I would break it into two pots. First is the logistics piece. It's receiving the resource requests from our counties and our hospitals, our first responders, everybody who's needing stuff. And that stuff normally translates into the PPE. That was our biggest all-consuming thing that we were dealing with through March, April, and May. And as we were being able to get our hands around it, be able to develop sources of supplies, that is still very much at the forefront of what we're doing. But again, we've been able to normalize the process, so it's not the frantic churn that it was in the early days of this. The second major effort that we're dealing with would be the administration of the federal public assistance grant that we get through the Stafford Act. And a lot of it, not so much the CARES Act money that's coming into the state that's being managed through OFM, but this is the Stafford Act money that comes through the normal traditional disaster programs that are going to be the backbone for a lot of the reimbursement for the protective actions that we're taking at the state or being taken at the local level, such as isolation and quarantine, paying for as much of the PPE as is eligible for reimbursement, and other eligible costs. And so those would be our two major lines of effort right now in our team.
Let's go back to equipment fulfillment. Under the rubric of personal protective equipment, we have masks, ventilators, gowns, booties. What am I leaving off that is of significance that occupied your time? And what among the whole constellation of demand has been kind of persistently the greatest demand?
Persistently, very, very early on in this, it was the N95 respirators. That the medical community would really need to keep themselves safe operating in a COVID environment where you have either actual or suspected COVID positive people that they were working with. And those on the global market were nowhere to be found. And we had states competing with each other trying to secure this stuff. We were competing with the federal government. Frankly, it was a mess. And that consumed so much of our time trying to develop sources of these. Finally, been able to secure large quantities of them out of China through a company called BYD. You've undoubtedly seen references to them in the news, that they've become a reliable supplier to the point where we're able to get significant numbers of masks in. So that was really our opening nightmare in all of this. And all of the different types of PPE that you mentioned were in very, very scarce supply. The other thing that we're noticing now is it's now becoming gloves. And we're able to secure gloves in quantity, but it's sizes. And so if we're looking for extra smalls or extra large, those are becoming increasingly hard to find. And so again, our Department of Enterprise Services is doing a fabulous job beating the bushes, trying to develop sources of these supplies so we can get them into the communities that desperately need them.
I'm getting conflicting and varying reports about the sufficiency of supplies of all types. I had one of these earlier town hall episodes with a registered nurse who works in a COVID-19 intensive care unit. And she had expressed that a lot of the frontline healthcare providers are being required to use N95 respirators beyond their protected useful life. Moreover, that there wasn't a closet full. They had no assurance each and every day that they went into work, either A, is this the day my N95 fails? Or B, is this the day where I'll go to the closet and there won't be a sufficient supply of X, Y, or Z? What's your perception about where we are, not just in terms of currently being able to provide, but to see enough ahead of time to give some level of comfort to the frontline workers who are obviously exposing themselves to the virus on a daily basis?
It's a tremendously complex issue because there are many different types of respirators for the typical N95, different brands, different models. Hospitals have their preferred supplies. If a hospital brings in a new model of respirator, it has to be fit tested on everybody who uses it to make sure that it doesn't leak. And so there's been a tremendous amount of learning that we've gone through because we kind of entered this thinking that a respirator was a respirator, and found out that's not exactly true. We've heard very similar stories to the ones that you've heard, that they're still in short supply. But as we look at the hospital supply statistics, and this is one of the things the Department of Health has built, is the WaHealth dashboard that gives us an ability to look into hospitals, look at their bed capacity, number of patients, but also looking at the PPE, we're seeing that most hospitals are reporting, several weeks of supply on hand. Now, that doesn't specifically speak to the fact whether or not they're in conservation strategies. A lot of them are, but we do see a tightening, I think, of the availability of these things in the hospital. So I would not counter what you're hearing out there and say that there's probably some truth in it, that these are scarce commodities, but we are building up a stockpile of the BYD masks that are available for the hospitals that need them.
So we're making progress.
Yes.
You mentioned earlier you've actually got a team looking into the future about what some of the downstream consequences will be of this. Insofar as they've even begun their work and discussed it with you, Director Ezelle, what keeps you up at night?
What keeps me up at night is what the second and third waves look like. And it's probably the biggest thing I wrestle with is how do we influence public behavior so that we can minimize the effects of the disease on the people of Washington State and keep the curve as flat as we possibly can. That is my largest concern, because if we cannot encourage people to wear masks, to maintain their distance, to do the fundamental things that they need to do to keep themselves and their families safe, it's not going to be pretty as we get into the fall flu season, as people go back indoors and we get into environments where we could see a higher disease transmissibility. That's what keeps me up at night.
So you would count yourself in the school that would observe the significant increase here a few weeks ago as not actually constituting a second wave, but that is yet possibly to come.
I am not an expert, and so I would never classify myself as an epidemiologist, but from all of the reading that I've done and just studying into this, that leads me to believe this is first wave only, and second wave is out there at some point in the future. And there's a school of thought that says we're not going to have a second wave. It's just going to keep crashing up against us with no pause. And I see that highly likely as well.
Depressing thought, that thought may be. Rena, let's go to another viewer question, please.
Absolutely. Laura from Olympia asked via constituent mail, the attacks on the post office have to stop. The Postmaster General, who owns shares in companies that directly compete with the post office, is blatantly trying to make it fail. That this is being escalated so quickly just months before the election, where many people will not feel safe attending polling places, is no coincidence. We need the post office for a safe election and for our day-to-day lives. Please, please make every effort to assert control and stop this sabotage of such a necessary institution.
Well, thank you, Laura. I could not agree more. And I find it extremely disturbing and discouraging, especially when you consider the post office may be the only federal agency that is specifically called out for in our United States Constitution. This is a constitutional charge that we have to provide for a post office. And indeed, it's a bit personal with me, if I may. My grandfather was a postal service delivery man, a rural delivery man in Texas. As it turns out, he worked for the post office in his entire adult life from 1905 until 1944, when unfortunately he dropped dead of a heart attack out on the back 40 of his little stump farm in Texas. When he began delivering the mail, he did so on horseback. And one of the biggest days in his life is when he was able to get a Model T to deliver the mail. He also was held up at gunpoint. This is the kind of thing that happened in rural parts of America in the early part of the 20th century. And so, as it were, I have post office blood in my veins. The House of Representatives has moved aggressively to provide for funding for the post office. And we have indeed communicated and conveyed in the strongest terms possible our disagreement with the new director of the Postal Service's mandatory elimination of overtime so that mail could be delivered on time. It's not now as a consequence, as well as a bunch of other moves he's making, changing out major leadership posts, changing out certain processing machines, all that frankly should have been delayed until we've been able to take care of the significant increase in demand on postal delivery that voting by mail will be required this year as a consequence of the lack of safety associated with going into voting in person So Laura, we're chipping away at it. We passed measures to fix it out of the House. They haven't passed the Senate yet, but we are not going to give up. America deserves this, and I owe it to my grandfather. Rena, next question.
Antoinette from Facebook asked, I have several family members who work as EMT and nurses, firefighters, and law enforcement. What is Washington doing to prevent a scenario like what we face with this virus in a possible next pandemic? PPE stockpiling, perhaps?
Yeah, thank you for that question. And that's exactly what we're looking at. We have been working very, very hard to secure the adequate supplies of PPE. And we realize that we must have a stockpile going forward, that although the federal government is putting together their own stockpile, we need to have something here in the state. And our local partners are also looking in many cases of doing something similar. So we're in partnership with Department of Health right now to determine what a stockpile looks like. We had a modeling group run a bunch of scenarios for us and give us some broad ideas of what different levels of PPE we would be looking at for the major commodities. And so we're using that to determine our baseline needs. And what we're looking at is a percentage of overall aggregate PPE demand for a period of weeks. And so we are ordering to and trying to build a stockpile in all of our key levels, such as N95 respirators, surgical masks, gowns, gloves, and a couple of other items to provide that fallback for our medical community if we do run into a situation where the supply chains go down again. So that is very much a work in progress right now. And we're pretty close to the levels that we think we're going to need on most of our major commodities.
And I just want to add, Antoinette, thank you for watching again. You have been a regular viewer of these town halls, and you've been a regular asker of very good questions. You're appreciated. Thank you. Rena.
Next question comes from Barnett from Olympia via constituent mail. Why is the state proceeding with opening in phases when we are seeing a new exponential growth in cases? What tool is the state using to encourage more people to follow mandates to wear masks and practice appropriate physical distancing?
Well, again, a very, very good question. The governor has paused reopening. As we saw the cases starting to build in Eastern Washington and then again here in Western Washington, the governor took the step of stopping reopening, and then we worked with the Department of Health team to provide some recommendations in addition that the governor could take some actions which he subsequently took to limit personal contacts in restaurants and other venues. And so I think the biggest thing that we need to do, and we identified this very, very early on in our approach to how we were going to deal with the COVID-19 pandemic, is a lot of it would hinge on public messaging. And it's making sure that we get the public messaging out there to encourage people to do what they need to do to keep themselves and their families safe. And it gets back to the basic hygiene points, mask wearing, and maintaining the physical distancing among individuals and among groups. And it's a matter of, we have to keep hammering out that message via social media, regular media, by people that different groups will listen to and will accept the message from. And that's key. It's all about modifying the personal behavior, because we don't want to go back to a reimposition of stay home, stay safe. I think that as much as we can get people to adhere to the basic principles of keeping themselves and their families safe is the approach that we need to do.
So Director Ezelle, thank you for that. Frankly, we've all been engaged in the effort to advocate for, make clear that we will all benefit greatly if we maintain social distancing, practice social distancing, wear masks, wash our hands, and all of the various recommendations that have been made. But the truth of the matter is, we're now 5 or 6 months into this somewhat sense of isolation. And if any of us has had one, we've had 100 conversations about the fatigue of not being able to be around people, because the truth of the matter is we're enormously socially oriented creatures. And so I think what I want to ask you is, what is it that you can say to the average person, myself included, about, especially given that there's no endpoint here? We're in a fog of ambiguity. We don't know when this ends. We don't know when the vaccine is here. We don't know when our social distancing and mask wearing practices will bring that R naught sufficiently low that we can, in fact, expand. We just don't know. And we're all getting tired. And we all yearn for people and for a sense of normalcy. What do you say to them to help convey the importance of us acknowledging and practicing these safe practices?
I would say we're all in this together. This is a difficult situation. I feel everything, Congressman, that you and the others out there do as well. I and my family feel that same sense of isolation. I very much want this to be over so that I could go back to life the way that it was before. But we don't have a situation right now that allows us to do that. And so it's a matter from my perspective of coming to grips with the reality of the situation, that we're going to be in this for a long time and a long fight, and that we're just going to have to pull together as a society and decide what we need to work together. We need to do what needs to be done, roll our sleeves up and see this thing through. As hard as it is, as difficult as is going to be, it's going to require some sacrifice on the part of all of us to do what's necessary. And we have to take that long view. It's not going to be over soon. It's not going to be easy, but we've got to do it because our society and the most vulnerable in our society depend on us to do that.
I miss my granddaughter very much. She lives in town here. She's 5 years old, and I haven't seen her in 5 months. And I yearn to be around her. I yearn for that run, jump into my arms, big squeeze my neck hug that means more to me than anything. And whenever I am feeling that deeply, I try to remind myself that if I can continue a day at a time, as we are asking everybody to do, to maintain social distance and all the other things, that it will keep it from getting worse, and that it will mean that the time that I get to hug her is sooner than it otherwise would be. Rena, next question.
This is from Elizabeth, who is watching live. I am an at-risk person. I have bad lungs, and this virus can kill me. I'm a mother, and I don't want to leave my children motherless. What are we going to do about schools?
Well, the first thing that I would say, Elizabeth, it was Elizabeth, right, Rena?
Yes, it was.
Elizabeth, thank you for the question. First thing that I would say is, while this is our 20th teletown hall on how we're coping with the COVID-19 crisis, we've had one or two on schools before, and we have a series of them coming up the week after next, beginning the week after next. In fact, we've tentatively scheduled a return trip from the State Superintendent of Public Instruction, Chris Reichdahl, on August 31st, I believe. And I think that there will be people that we talk to in subsequent town halls that will be able to give you much more concrete information about the look going forward. I would invite you to stay tuned and keep yourself aware of these, their day and time, rather than give you an answer off the top of my head based on what I know thus far. Why don't we just hold that thought, Elizabeth, because we have people coming who are actually in the seats of decision making. I understand very much your concern and your frustration, and we hope to get you some answers through those conversations. Rena.
This is from Nancy from Puyallup, who sent this via constituent mail. I'm a landlord. I live and own in a duplex. My renters are not paying me. As of August 1st, they owe me $9,600. I'm a single working woman who depends on my rental income. Will there be assistance from the state in recovering rents once the moratorium is lifted? I believe my renters would stay rent-free until the moratorium is lifted and then move out, leaving me unpaid. I know many landlords in this position.
Well, Nancy, thank you for the question. And by the way, Director Ezelle, as it might be apparent to you by now, people like to write or call in with questions that aren't always directly related to the nature of the expertise of the guest. So I beg your indulgence as I field some of these. Nancy, I just read in the newspaper that Pierce County has set aside some money for rental assistance. And I would hope that you're in a circumstance with your tenant that you're able to have a conversation with them about maybe reaching out to Pierce County or to the city of Puyallup. I don't know if they have any funds for this purpose or not. But I want you to know at the federal level that there are efforts underway in earnest to provide relief for renters and landlords. It happens to be an issue that I'm involved in very directly. In fact, I introduced a bill in March to provide $100 billion nationwide. Sounds like a lot of money, and it is, but it's spread out over the nation to provide renters and landlords with rent relief. The fact is that in the last month, there were 36% of all renters who could not pay all their rent and 20-some% who couldn't pay any of their rent. It sounds like, Nancy, you've got one of those tenants living in your unit. The truth of the matter is that we're not going to be well served in our efforts to combat the COVID-19 crisis if we have wholesale homeless people. People living in encampments under bridges are in a much more perilous from a public health situation than they are with decent shelter and a roof over their head. But the truth is as well that we have lots of landlords who are dependent upon their rental income. And it matters that we help not just the renter, but the landlords. Now, here's the fact. About half of all rental units in this nation are owned by what we call mom and pop operations. They're not national corporations with high-rise condos or apartments. They're people who chose, instead of building a 401k for retirement, for example, to buy a duplex or two and use it as a means of their retirement security. They have bills to pay. They have mortgages to pay. They have maintenance people to pay. They have property taxes to pay. And the truth is, we are not going to be well served by either having that renter kicked out on the street, nor by having that landlord, especially these moms and pops who don't generally have access to capital in any other means, having to have their units foreclosed on. So we're fighting like mad to get the rental assistance. It was a part of the HEROES Act, which passed the House in May. And it is a part of what we are advocating for any possible additional relief package. I was exceedingly encouraged just a short time ago when finally the administration's representative in negotiations, Secretary of Treasury Mnuchin, publicly acknowledged the need to provide for some rent relief. It was the first such acknowledgement that I had seen. So we're fighting for it, Nancy. We're going to continue to fight for it and keep your fingers crossed that we're ultimately going to be successful in persuading the Senate that this is something that needs to happen to keep America's whole, families whole.
Congressman, if I may. This is something, Nancy, that we're also in regular conversation with the governor's office, and it is clearly recognized as a need, as Congressman Heck said, that both to protect renters and landlords, and so that it's something that is being very carefully looked at and looking for the different forms of assistance that the state could provide in addition to the federal government, because we know that this is a crucial problem that must be solved.
So, Director Ezelle, were there funds in the CARES Act that went to the state that the state shared with local governments that can be used for this purpose? And if so, where would you point people?
I believe there was, but again, I would point people to their local authorities. And but I can get back to you with a better answer than that you can provide back out to your constituents.
So call your city, call your county. And if you're unable to get an answer there, by all means, call our office. Rena will provide you with that number at some point before this town hall is over with. Nancy, thank you very much for the question.
So the phone numbers for Congressman Heck's district congressional offices for Thurston and Mason counties, that's 360-459-8514. And for Pierce County, that's 253-533-8332. And moving forward with the next question from Terry Bergeson, who's watching live.
Terry Bergeson, we should note that Terry is a former elected state superintendent of public instruction. And I'm so delighted that she would join us as well.
Terry would like to know, how are you working with school districts to help them prepare for schools to open virtually or in person?
I'll take that one, Congressman. We are not working directly with the school districts, but rather it is Department of Health working directly with OSPI and the governor's office to outline the broad guidance. The governor went on the air last week, looking at the guidelines for the different risk levels in counties, what they could use to consider either in-person instruction or remote instruction, and then considerations for instruction for at-risk kids. And so that guideline was promulgated, and then it's OSPI and local health jurisdictions working with the individual school districts on their reopening plan. So that's the broad framework for how this discussion is taking place within the state.
I think it's fair to say, if you know otherwise, Director Ezelle, please correct me, that a majority, if not an overwhelming majority of students in the state will begin the school year with distance learning. In fact, I'm not even aware of some districts that are going to do in-person learning, but I'm sure there are in areas where the incidence of COVID-19 infections are low. But generally speaking, we're going to start the school year with distance learning. And again, stay tuned for our town halls coming up week after next with all the experts, various experts in this regard. It is an enormously difficult and complex problem, and it's one also that is contemplated in the HEROES Act that passed the House, had significant amount of resources for school districts to help with things like making sure all students have devices or laptops, all students have connectivity so they can get online. School districts have resources to have the appropriate software platforms for distance learning. School districts have resources to ensure that they can transport students, because you can't seat them side by side in a bus, obviously safely. School districts have resources to engage in the kind of cleaning that is necessary, the kind of distancing from one another, utilizing more space than traditionally. But again, more about that later. Rena.
We have several questions from live viewers regarding enforcement, so I'll just read one. This is from Pat. My partner and I have seen 3 groups in the last 2 weeks not social distancing. I tried to get a response from a number of public safety agencies, including County Emergency Services, Olympia Police Department, County DOH, State DOH, because I think there should be a response mechanism to get people to socially distance. I think we have to have a coordinated response team and a way for citizens to report non-distancing. What can we do to change that?
Well, that is a good question. And I would say that enforcement has been a constant theme within the discussion about the non-pharmaceutical interventions or what we're doing to promote and engage social distancing. And when it gets to private individuals and either private or public property choosing to not socially distance, it becomes a very, very difficult a challenge between as to who responds and whether local law enforcement offices have the capability or perhaps even the intent to respond to those situations. Where it becomes a little bit easier is if one sees non-compliance in businesses. And so we do have a business hotline where people can call in, explain what they've seen, and those will be followed up on, and have personally seen a couple of instances where we followed up with very great success and had large companies change the way that they do business, and even nationally change their policies on how they're going to deal with this. In terms of setting up a special group, team, task force for how we look at enforcement or even conduct enforcement, again, off the cuff, that's extremely challenging because if you do not have credentials or the appropriate backing to engage and training even to engage in those interventions, it becomes very, very problematic, or could even be a safety case for people trying to do that. So that's something that if we were to implement something like that, we would have to think through it very, very carefully on how something like that would be done. And so, which is why I think it would be better to go back to individuals who would be charged with some form of enforcement, who have the legal authority to do something like that. And so I know that's partially a non-answer, but I will say that enforcement, how to do it or where to choose not to enforce and rely basically on the goodwill and the cooperation of the public, has been an issue that we've discussed repeatedly as we've gone through this incident.
Director Ezelle, are the following two things, however, true? Number one, non-pharmaceutical practices have been demonstrated, and by non-pharmaceutical, of course, we're back to the old social distancing, wear your mask, wash your hands, etc. Have they not proven to be overwhelmingly effective when they have been universally or near universally practiced?
Congressman, I would say that that's absolutely the case. And I think that they were tremendously effective in breaking the curve back in March, April timeframe. And then as we saw the interventions relaxed going into late May and June, we saw the disease coming back. We saw numbers climbing. We're now seeing fatalities climbing. The governor introduced his universal masking order, rolled back some of the NPIs, stopped the reopening, and as a result of that, we can see the number of cases starting to decrease and the curve bending back down again. So I would say absolutely we've shown that those NPIs are effective.
In other words, we can open up faster and more safely if we will do what we know works, period.
Yes.
Is it also true that given the nature of our society, that the first line of effort where we are having difficulty doing that which we know needs to be done is through education and persuasion?
I think that's absolutely the case. It's persuading people to do what's right. And they have to see, they have to be presented a case that they can understand. So it gets back to the education piece, and then see how it's in their best interest to do what they need to do to keep our society safe.
Rena.
The next question is from Celeste, who is watching live. Any advice on how to support our neighbors with school-aged children who will be distance learning this fall?
Director Ezelle.
I think do whatever you can to help. And if there are chores, so say you've got a parent who's at home, who's looking after kids, trying to facilitate the distance learning, what can you do to take the load off of them? Can you run an errand, go down, buy them a load of groceries? Can you go down to Home Depot and buy some things? Can you help with yard work? And again, it's community pulling together. And that's one of the things that we always talk about in any kind of disaster, whether it's a flood, whether it's an earthquake. The first people to help each other or the first people to help are neighbors helping other neighbors. And so I don't see how this particular disaster is fundamentally different. It's being plugged into the area where you live, the people who live around you, being sensitive to the needs, and then pulling together to take care of each other and do what you can.
I would only add to that anything you can do to perform a task which must be done by that parent, and therefore you would relieve them of that burden, is of help. It's hard to imagine a more difficult circumstance than trying to manage or supervise the distance learning of your children, especially the smaller they are, while also, frankly, trying to work remotely from your home. That's like having two full-time jobs at the same time, and it's incredibly difficult. Rena.
Thank you. The next question is from Julian, who's watching live. What plan is there to maintain public safety in neighboring counties starting to diverge in reopening phases? For example, if Pierce stays in phase 2, but let's say Thurston goes into phase 4, is that hypothetical scenario considered problematic?
I don't know that it would be considered problematic. Again, it's clearly communicating to the counties what phase they're in, and this is something that we have seen or have heard repeatedly through this. I don't know what phase my county's in. I don't know what I am allowed to do or I'm not allowed to do, and we hear that across the state. Or, you know, I'm traveling into another county. What can I legally do? What can I not do? It's just us making sure that we get the information out there. And I'm not sure that I understood the public safety implication of the question that the listener first raised. But again, it's a matter of clearly communicating information. Law enforcement or public safety entities routinely communicate and coordinate across county jurisdictions. They have those agreements in place, routinely work that way. And so again, it gets back to messaging, clearly communicating to people what the left and right limits are and what they can and cannot do in the phase that they're in where they live.
I think their point was that the virus doesn't know where the county border is and people get in cars.
And we've seen that across the state. And that is one of the challenges. The more people travel, the greater the risk. And so again, if we can encourage people, no matter what what phase your county's in, if you could limit your travel, limit your mobility, we're all in better shape if we can do that. And we watch mobility statistics, and we see it by county in our coordination meetings, looking at, you know, where people are traveling more. And you can correlate disease increases to the amount of time that people are on the road traveling around. And so again, this is just one more of those things that we can do to limit the spread of the disease, is not travel unnecessarily. And again, it gets back to the sacrifices we have to make. It's difficult, but these are things we have to do to tame the disease.
Well, let's go there. Where are we in terms of travel today versus in the immediate aftermath of the stay-at-home? What percent, let me ask the question another way, Director Ezelle. Where are we today compared to where we were before we had the executive order for stay-at-home? What percent of normal or pre-COVID are we at?
It's difficult to, because we don't have the statistics from pre-COVID, but we go back, we look at the way it was back in January when COVID first hit. And so really the baseline that we're operating off of, it would be a winter normal, not a summer normal. And so what we were looking at as we went through March, April, we were down when the governor first instituted stay home, stay safe. We were down at about 70% below normal. We still had essential industries open, but the travel was way, way down. And we were looking at different sectors. We were looking at things like park, we were looking at retail, we were looking at grocery, and the numbers were different because people obviously had to go out and get groceries. And so people were on the road to do that. There wasn't a lot of recreating, so parks were way down, retail was way down. But as we came off of the stay-home orders and started reopening, we saw the trends go back up to the January normal, and in many cases were 20 or 30% higher than that January normal baseline. So what we've seen since the governor has tightened things up a little bit, we're sort of leveling, but again, we would be better off if we can bring the travel down and have people stay within their localities to the maximum extent possible.
Well, in March, April, we were down 70% from that January level. What are we now?
We're actually above that January level by about 20 to 30%.
But we're comparing apples to oranges, summer travel to winter travel.
Exactly, that's the problem. We just don't have the baseline travel data from last summer.
Rena.
The next question is from Sharon from Lakewood, who asked via constituent mail, why did the life-saving extra food stamps stop when the extra unemployment stopped?
Well, they did stop. They were scheduled to expire along with a lot of the other provision of the CARES Act. As you know, the unemployment compensation bonus stopped, the eviction moratorium stopped, and several other measures stop. Again, the House was advocating for an extension of that, and an extension of that was included in the HEROES Act. It is yet another element that we are advocating for in our negotiations with the Senate. Food security is significantly threatened right now, above and beyond what it normally would be, even in the context of a very deep recession. I want to remind everybody, there's a lot of pain out there. We're still at double-digit unemployment, and that's the narrow measure of unemployment. If we had the real measure, which is to say people who are out of work and have given up looking and therefore they are not counted, we are talking about unemployment levels not that far off from the Great Depression, which is all to underscore the importance, frankly, that Congress get its act together and be able to pass another relief bill. Rena.
Michael, who is watching live, asks, why can't my daughter, who works as an RN at a Washington hospital, be periodically tested by the employer? Scary getting together with her these days for us seniors.
Again, I would have to go into the hospital's policy. That's not something that we would regulate at the state level. And I think that that would be between the employer and the staff and potentially the employee's insurance, how that would work. It's not something that we would drive at the state level.
There's no good reason why she's not being tested is the direct answer to your question. In fact, there's no good reason why testing isn't significantly more robust in this country than it is right now. There's no good reason why these tests are taking sometimes 3 and 4 and 7 days to get the results back. There's no good reason. What we needed to do at the get-go, and lots of voices advocated for this, was trigger the Defense Production Act for the production of the testing material and have a national protocol and regime so that states weren't out competing with one another, scrambling in the open market, getting their supplies where they could, bidding one another up. There's no good reason why your daughter isn't being regularly tested in the capacity that she works, period, full stop. There are significant funds in the HEROES Act. I hate to keep bringing it up, but there are significant funds in the HEROES Act to provide for increased testing and the requirement of a development of a national strategy. Again, just like counties, just like the virus doesn't know county borders, the virus doesn't know state borders at all. This requires national mobilization, nothing less. Let me remind you, we now have more than 160,000 people who have died. That's more than several of our last wars combined, save World War II. This requires national mobilization. Karina.
Thank you. Phil from Facebook says, I understand that the ACCs are closed to the public, but are they closed to volunteer groups who support DEM? Thurston County has a volunteer group of amateur radio operators who provide backup communications. We would like to get in on the radio room and check out our equipment on a regular basis. It would be only 1 or 2 people from our group doing this testing. Thanks, Phil of Thurston County Amateur Radio Emergency Service.
Phil, I'd like to start by thanking what you and your peers do. You provide an absolutely invaluable service to the state of Washington. And I cannot say enough about your dedication and your spirit of volunteerism for the great work that you do. I would ask you to please contact your local emergency management and make that request because Thurston County has their policies, and if you talk to the emergency manager and make a case there, they may be able to let you in. I know that we rely very heavily on our emergency radio volunteers as well. We're not bringing them into the building at this point just due to risk. We're trying to minimize traffic in and out of the State Emergency Operations Center so that we minimize the risk of bringing the disease in here. But again, we're at the state level. I would really strongly encourage you to reach out to Thurston County Office of Emergency Management and discuss it with them. But again, thank you for what you and your team do. We couldn't do what we do without you.
I want to add my voice of gratitude to that as well, Phil. What you do saves lives. Thank you, sir. Rena.
Thank you both. We have reached the end of the hour, and this will be our last question from Antoinette, who is watching live. My family and 2 different households were evacuated from the flood in February and then straight into the shutdown from COVID-19. What is the best emergency preparedness do you recommend for households? And have you made your responses to issues like flooding quicker? How do we improve the communication about who's affected and where to get assistance?
Okay, I'll jump in and try and tackle this multifaceted question. When COVID first kicked off, we were looking at potential shortages in food. Everybody saw the empty shelves, and what it drove home to me and to many of my peers. In fact, I even got a message from a former EMD employee who retired over a decade ago, emphasizing the need of people to be personally prepared. Whether it's for a flood, whether it's for an earthquake, whether it's for a pandemic, the 2 weeks ready message that we have here in Washington State is as germane in this situation as it is for any other type of disease. So just would strongly recommend in every possible terms that the need for families to be prepared. Have supplies of food, water, medicines on hand, have communications, have a communications plan. You know, everything that is out there in our brochure that you could look at for 2 weeks ready. It's on all of your county websites as well. Start with that baseline. That's the most important thing that you can be doing. And Rena, could you read again the other aspects of that question?
Absolutely. What is the best emergency preparedness do you recommend for households? And then the second portion, have you made your responses to issues like flooding faster? And then finally, how do we improve the communication?
Yeah, so the 2 weeks ready would answer the first part. When it comes to flooding, I think that we have done everything in our power to respond quickly to that one. Our response obviously is complicated by the fact that we're dealing with 2 extremely large disasters at the same time. And so we're doing everything possible that we can to deal with both of them. And our team is fully engaged to provide the assistance. We advocate very, very strongly for individual assistance, which is assistance to impacted households. We did not get that from the federal government for the flooding. We got it in a limited way for the pandemic. And again, that we continue to advocate. We've spoken with Congressman Heck and the rest of the congressional delegation on the needs that are out there. And so again, we continue to advocate for that assistance that goes to impacted individuals. And then finally, the communications issue, we do everything that we can to communicate across the levels of government, but also to make sure that the messaging that goes out to our citizens is consistent, informative. It provides you the tools that you need to deal with the situation, and to the degree possible, we continue to emphasize that. So, Congressman, anything to add there?
I have nothing to add to that. Thanks again, Antoinette. But I did have a question for you, actually. It's mid-August. How's wildfire season going?
We are actually doing very well. And it has not been a terrible fire season like we saw back in 2014, 2015, or even 2018. We're relatively low in terms of numbers of acres burned. We're reasonably high on number of ignitions and fires fought. So Department of Natural Resources and our local fire districts are doing a fabulous job on jumping on the fires as soon as they break out and getting them extinguished fast before they can grow into something ugly. So we've been helped by the weather this summer. It's been at seasonal norms rather than extremely high temperatures, but we're not out of the woods yet. We're mid-August. We're looking at some more significant fire weather coming up over the next couple of weeks. And historically, we've had our really, really bad fire seasons break out in the late August timeframe. So I'm nowhere close to declaring victory on this one.
Stay tuned, huh? Director Ezelle, I have a hard time not calling you Colonel Ezelle. Thank you for both your careers of public service. I'm guessing that when this first hit, you went a while without having a single day off. And I'm hoping that you can at least get some rest at least once a week now as we attempt to cope with this. But I thank you very, very much for all of your efforts in this regard. As I thank the viewers for joining us, thank you for giving of your most precious commodity, your time. Again, stay tuned to announcements about our future mini-series of various town halls on the issue of the reopening of schools and the various ways in which our schools and other organizations are attempting to respond to the COVID-19 infection. In the meantime, socially distant, wear your mask, wash your hands, be safe and stay healthy. And thanks for joining us.